February 6 marks International Day of Zero Tolerance for Female Genital Mutilation and Gender-Based Violence Against Women and Girls. As part of activities marking the day, government institutions, civil society organizations, and activists are intensifying efforts in safeguarding the rights of women and girls in the Gambia, with a particular focus on ending FGM in the country. A renowned gender activist, Mrs. Binti Jame, disclosed the dangers associated with violence against women and some significant issues that needs to be considered when dealing with such violence.
Commemorating the International Day of Zero Tolerance to FGMC. Wassu Kafo is an NGO that was established here since 1999 with the aim of conducting clinical research to allow us to have the necessary and requisite data to address the issues such as FGMC, which has been, I would call it a thorn in the flesh for the past years.
Rosar, UNFPA, UNICEF call on stakeholders and decision makers to support the fight against female genital mutilation.
I call on each man in this room and across the country and around the world to say no to FGM in their community. We need transformative agents in each and every one of you. It is clear that without the support of men and boys, we will not reach our target in 2030.
Dr. Mustafa Bete, Director of Health Services at the Ministry of Health, discussed the health and other implications of FGM, thus the need to end the practice.
So there's no reason for us to be involved in that because we've done few studies, even with the ministry. And you've seen that when they looked at postpartum hemorrhage, obstructed labor, those who did not do this practice, maximum was about 23% compared to 77% in the other side. And there are areas where you have 5-fold increment amongst those who did not do it. So there's a significant relationship between the practice and some very bad obstetric outcomes.
Marianne G. Jabang, Director of Gender Equality and Women Empowerment at the Ministry of Gender and Children Affairs, noted some key factors in eliminating FGM.
November 24, 2015, the Gambia joined 18 sub-Saharan African countries, including Nigeria, to ban the practice of FGM. A bill was passed at the National Assembly on December 28, 2015, criminalizing the practice of FGM in the Gambia. Monitoring the practice of FGM and enforcing the law, however, continues to be a big challenge. Although FGM reflects gender inequalities and violence against women and girls, and is prohibited by the Women's Amendment Act of 2015, FGM unfortunately continues to be practiced in the Gambia.
According to activists at the forum, the anti-FGM laws were enacted since 2017 with the primary objective of ending female genital mutilation and violence against women and girls across the country. They are, however, concerned that the practice still exists in some quarters of society. For GRTS News, this is Yero Jalo reporting.